Okay, great. This is a wellness, Healthwise and Wellness. My presentation is all about empowering youth mental health through wellness, team building, and natural healing approach. You can see our motto is the greatest wealth is health. Mental disorders globally, mental health globally, about in every 7 adolescent lives with a mental disorder, according to World Health Organization. Rising anxieties, depression, substance use, and trauma. We are seeing sharp rise in case of anxiety, depression among young youth, often linked academic pressure, unemployment, and social challenges. We have the youth mental crisis. Most cases go untreated, even though youth mental health problems widespread, the majority remain untreated. The reason why is because of the stigma, and lack of supportive system whereby the youth can be in a better way to express themselves. I'll go about Healthwise and Wellness, the kind of a program we go about in our facility. It was founded in 2010, over 10,000 clients served. Our vision is the greatest wealth is health. Our core philosophy is body, mind, spirit interconnected, whereby the prevention and cure, community-centered healing. Our services, we normally do the mental health therapy, addiction recovery, women health care, team building and youth, and we also do the Ayurvedic natural medication. Our program in addiction recovery program, we do early intervention and prevention training. This is whereby we do the intervention early enough so that at least we can put together how our youth are going to be in a better position to express themselves through the prevention trainings, whereby we do intervention early enough, especially when it comes to addressing substance abuse, anxiety, depression, and other mental health issues. So when we do it early enough for the team building and other activities, especially in sports, it's become more easier for the youth to be in a better position to relate very comfortably. In the means of training and doing the early intervention, it always helps the youth to be in a position to understand that they can express themselves with no big stigma of the addiction, anxieties, We also do the women-focused addiction support. This is where we do the specific training for the gender-specific training, support groups, holistic care, where we do yoga, meditation, so that at least it can help them to focus and get proper way of recovery, and also eliminate the stress levels, and also be in a position to understand the addiction support. We also have peer-led recovery groups where we do relapse prevention strategies. This is by incorporating the team building in early intervention strategies. This always helps the youth to thrive and grow and get also well in participating in various activities together with their peers, mentors, counselors, and psychologists. They work together, and also the wellness coach. We also have the youth empowerment and team building, the support group wellness routines. This is where the youth undergo the sport activities, and those sport activities, they are put into groups where they learn more about addiction prevention, and they also talk in group therapies where they understand, they learn through the various people who have already gone through the addiction, and they can be in a better position to understand and cope, because that is the best way to work with the youth through sports groups and wellness routines. Team buildings, they also make them share together or what at least they are going through, and they also get mentored. We also do the confidence and leadership skills, where we train short courses. After they come out from the rehabilitation centers, they can be in a better position to understand what they can get the skills, so that at least they can learn in the pathway to recovery, get to learn more skills which they can support themselves in socioeconomic upkeeping, not to drag themselves into other peer pressure and taking substance use, and also alcohol abuse. Emotional intelligence through teamwork. This is where they have the confidence after going through the training of leadership skills. They are able to make their teams to work through their sponsors, their trainers, and their wellness coaches. Evidence and outcome. You can see the anxiety and depression symptoms. Before the program, it was 80%. And after the program, going through various team buildings where the youth gain strength, confidence, having no stigma, getting supported by the wellness coaches, it dropped to 30%. So that one is a plus when we go into the evidence outcome. You can see self-esteem, because mostly the youth, when they are going through all the depression, anxiety, the self-esteem level goes down. That is why you can see before the program, it was 40%. After the training, after earning information about leadership skills, learning short courses, which can enable them to get the source of income, the self-esteem raised to 85%. And this is where we need to encourage our youth. Every time we are having those trainings, prevention of addiction, prevention of substance abuse, prevention of alcohol use disorders, we can make a very big stride when it comes to helping the youth to thrive in wellness. School performance and focus. Before the training, you find that those youth, they come over when they are low as 45%. After the training, after the program, it raised to 75%. You can see this is also very helpful, because the college and university students, they will get themselves comfortably achieving. And this is also a plus when it comes to engaging the youth even in future employment. Over 10,000 people are reached. We can also see why this model works. Integrate physical, emotional, social care. The integration of physical, this is where we train in sports, in other activities like hiking, doing sports, team building. It eliminates the emotional, whereby the social care, the youth are able to engage themselves with their peers. For those who have gone through the addiction and have recovered, they share most of the life they have gone through, and they are able to recorrect themselves back again. And also when they are doing the sports, team building, they are able to engage themselves with their trainers, the wellness coach, the sponsor, and also the institution whereby they are going through the leadership skills. And all this is rooted in African context, whereby we treat the community level in the African context, that people, they share in sports, they share in activities, they do things together to improve the kind of wellness that each and every community has to offer. It is also scalable and preventive. It is easy to use, it is easy to adopt. It is also the best therapy on preventive measures when it comes to preventive measures of addiction, substance use, and other issues like gambling. It is very health initiative where everyone is involved, both in institutions and other social places. Now we come to call to action. Let's collaborate. The clinicians share best practices when it comes into wellness and rehabilitation centers, where we normally do the life diagnosis, so that at least we can be in a better position to help those who are coming with co-occurring issues. The treatment has to be done quite well. The follow-up has to be also conducted in the best practice possible. The researchers join in evaluation studies so that at least we can see other programs which are in a better position to come for the rescue of the world or the global youth who are mostly vulnerable into all these issues about addiction, depression, anxieties, so that our researchers can be in a better position of what kind of strategies of evidence-based that can be used, so that at least we can be in a better position to rescue and give the training, the treatment in a very holistic way. The policymakers support all these other preventive framework, where we can incorporate the policymakers to come up with the best strategy systems, giving funds, giving grants, so that at least those countries or those nations that they cannot be in a better position in implementing the preventive framework, they can be supported through trainings, through teaching materials, and by that, every youth can be in a better position to enjoy the support in preventive framework, where the policymakers can come up with a better strategy to give the whole support. Community workers, partner in outreach. This is where we can involve the community, especially the charitable organizations, the churches, where they can come up with a better strategies to incorporate every aspect of training, of giving support, initiating ways from the grassroots, from the community level, to give support and partner in a better holistic way of enabling the youth from the schools, the colleges, and at the same time in mosques, in the Christian backgrounds, so that at least each and every community workers, they can give their best to support this noble move. I think if maybe there is any questions that at least other participants they can raise after I finish my presentation, I believe we can have some questions, and I believe that every part is going to be given a priority towards any arising question. Thank you.